Hi, this is Wendy Briggs with a case acceptance tip. After the case presentation is all done and we're finished in the operatory with the patient, we've gone over treatment that they need in mandatory, elective, and cosmetic categories. There's still a very important step that needs to take place before we can actually begin this treatment. And that step is the financial arrangements. And often this is where we hit a snag, we hit a roadblock with the financials. Patients might feel they can't afford this treatment. Patients might feel like they only want to do what their insurance covers. They may be very insurance focused, and usually, sad enough, it's because we've trained them to be that way in dentistry. So how do we overcome these financial objections? Well, I find there's a few things that we can do that help us become more successful in this area. We need to have one financial advisor or financial coordinator in our practice that can go over the financial estimates the majority of the time with our patients. It's important that our patients begin to establish a relationship with someone. Okay? We've got a lot of options, a lot of great solutions for our patients today that we didn't even have 10 years ago. Outside financing companies such as Care Credit, Capital One, Unicorn, a lot of great companies that provide a really good service for our patients who are looking for more comfortable payment options. What I found is often with patients, it's not how much does it cost, but often it's how can I pay you? What are my options? Do you have terms that I can afford? And so your tip for today is when you're going over your estimate with patients, instead of saying they have $5,000 worth of treatment, talk about it in terms of a monthly payment amount. If this sounds like the kind of dentistry you're looking for, we can probably get it done for as little as about $150 a month. And what we found is patients base their buying decisions based on a monthly payment amount. It's not the entire total of what the treatment's going to cost. So if you change your paradigm a little bit and start talking with the patient in terms of monthly payment amount, what happens is you'll have a lot more patients go, I can afford that, rather than go, oh, $5,000, that's too much money for me. So again, having good financial options in place for your patients, being able to review these options with them the day they receive their treatment plan is important as well. We can't send them out the door and say we'll call you and let you know what your options are anymore. We really need to get it handled before the patients leave. And again, ideally, we're talking about their treatment in mandatory, elective, and cosmetic categories, which does another really powerful thing with our patient's level of understanding, especially when it gets to the estimate. Because instead of a $5,000 treatment plan, we can break it down into more comfortable bite-sized pieces. And there may be only $1,500 that's mandatory, $2,500 that's elective, and another $1,000 of cosmetic or what have you. So breaking it down and using those terms is really important. And again, having flexible finance options in place will help us significantly do more dentistry.